Hi, my name is Jong Han. This is my milestone 3 presentations on optimizations and predictive management of cancer patient. Let me begin with the use case overview that cover current methods and practices. So imagine a patient goes to the hospital to see doctor to complain about certain pain, and upon suspicion of cancer, the doctor will send the patients to the radiology department to take some MRI images, and the radiologist would look at the images to find out if there are about potential cancer, and blood tests could also be done on the patients. So that if a cancer mass has been identified, so the physician might perform by biopsy by taking a small amount of tissue to be sent to the pathology department, and the pathologist will confirm if there is a cancer. And so upon confirmations, the patient will undergo several modes of treatment: radiation, chemo, immuno, or surgery. Now, so there are several limitations and problems with this current approach because it is a low throughput. So radiologists and pathologists can only handle certain number of cases a day. And especially the pathologists need to look through the microscope lens for long hours in order to diagnose the histopathological images. This could lead to eye fatigue. Yeah. And so the therapeutics delivery itself is a complex process, and not everyone is competent to do. And so the certain treatments can be hazardous if not handled properly. Yeah. And also there might be a long waiting time for the patient's turn to get the treatment. So these are the AI components of my AI brain. So in the for histopathology and radiologies, you could build perception model, two perception model. One is to detect whether or not there are cancer, and then this can help the physicians to do a mass screening to pick up only the relevant images for further evaluation, such as to find the location of the cancer and also to grade the cancer according to its progression. Yeah. So for cancer therapeutics, there are existing mathematical calculations for the couple of relationships and pharmacokinetics, radiation, and so on. And so ML models could be built to help the physician to do the predictions on the diagnosis, prognosis, and therapeutics choices. And existing optimization can also be improved using ML, which we'll see in the next slide here. So there are a couple of combinations of a treatment that the doctor can do. So which one is the most optimum for a particular patient? This could be achieved using a deep reinforcement learning. And for chemotherapy, so the physician could start with a high dose, and after that, the patient is evaluated using these parameters, and the outcome are fed into the expert system, and there is a ML classifications to help to infer or to do the predictions, so that the doctor can make decision whether to do a feedback or to feed forward. And so this could minimize wastage, maximize remediation, and minimize relapse. Okay. And so this is another example of optimization on radiation therapy, where a physician can overlay a grid over the cancer mass and use optimization method to choose which grid is the most suitable to be irradiated in order to kill the cancer cell without harming the normal cell. And so, and I conclude this presentation with the KPIs and the value of my AI brain. So this AI brain could bridge the gap between a novice and expert, and the AI brain, and can never get tired and never get eye fatigue, and give you the results anytime, anywhere, 24/7. The same goes to the therapeutics, and so these are the KPI that you can formulate using combinations of the existing practices with the machine learning and optimization, deep reinforcement learning, and so on. So this concludes my presentations, and thank you for your time. Thank you.